Hi, this is Dr. Donald Pelto. I want to talk today about how to treat Achilles tendonitis. This is a typical condition that we see in the office, and I want to clarify really what what Achilles tendonitis is and what it isn't, and how the treatment of this condition can be done. So let's start at looking about what Achilles tendonitis is. And usually patients come into the office, they have pain usually on the back of the heel region. So there's two main regions where it can happen. This is the Achilles tendon that is made up of the gastroc and the soleus. They both come down and they merge into this tendon. You see this white tendonish substance. This is red and beefy, so it has good circulation. This tends to have a little bit less circulation. There's an area called the watershed area, which is an area just above where it inserts into the bone, where it becomes a little bit weakened, where there is less blood flow, and it can become injured a lot easier. What happens with the Achilles tendon, there can develop a little bit of micro tears inside of the area, and this can then cause either some tearing or some thickening in the area. It develops thickening over time, and that becomes more of a tendinosis, which is a chronic inflammation of the area. And then in the beginning, it's called a tendonitis, which is just a little bit of tears and inflammation into this area. And usually when people present into the office, they either have pain above where it inserts or they have pain right in the back of the heel where it inserts. Because as you can see, it doesn't insert in just one little area. It actually has some flaring out on both sides. That's basically Achilles tendonitis. People tend to have pain when they get up in the morning, pain when they sit down for a while and then get up, and especially pain with this foot when they go downstairs and are on one foot and kind of go down on the bad foot as they go down the stairs. That engages everything and causes pain. I want to go over a little bit about what Achilles tendonitis is not, so you're not confused. Achilles tendonitis is related to, but not plantar fasciitis. Plantar fascia pain is usually pain on the bottom of the heel and not on the back. Sometimes it can be both. People can have tightness, and you can see why. Because if you have tightness in the Achilles, that attaches to the heel, and the fascia also attaches to the heel. And that's where it can get a little confusing when you're treating it. You have to make sure you have Achilles tendonitis, not plantar fasciitis. And usually the treatment for one is very similar to the treatment for the other. So if you want to learn about treating plantar fasciitis, go to my website, centralmasspodiatry.com/heal, and they'll have information on plantar fasciitis. So let's go on. It's not plantar fasciitis. It's not going to be any pain in the back of the calf, like the posterior tibial tendon. Sometimes that can cause pain in the back. Usually that's different than Achilles tendonitis as well. You don't want to confuse that. Also, you don't want to confuse a heel spur. So many times people have the Achilles tendon comes down and inserts into the heel. Sometimes this heel spur may break off. Sometimes there may be a problem in that area, and that can be problematic for treatment. So once again, Achilles tendonitis is not a heel spur. Sometimes the heel spur needs to be removed. That may or may not have Achilles tendonitis with it. The spur isn't always the problem. Many people have spurs, but no problem. And some people have spurs, and it's only that bump that causes problems. So you have to really determine that with an x-ray. Also, it's not Haglund's deformity. So let me show you. Haglund's is a bump in the back, like an upper outer bump right there. That's a bump on the heel, and sometimes that can get a bursa, like a bursal sac, either behind the Achilles or right on the back of the heel bone, and that can become problematic, can become painful, but usually that's not Achilles tendonitis. The treatment is different for this Haglund syndrome. As well, it's not an accessory bone in the back of the talus. That's another accessory bone called an os trigonum that can become painful as well. It's all in the general vicinity of the Achilles tendon. For kids, if they come in and they have kind of a growth plate back here, that can be confused with Achilles tendonitis. If you're seeing a child for heel pain, usually it isn't Achilles tendonitis. Usually it is the growth plate called Sever's disease, and it's a growth plate problem. That not a problem, it's just natural, and when the Achilles tendon pulls too hard, it can cause inflammation in this bone area. It's usually not a bone tumor either. That could be confused as well. And it's not going to be the posterior tibial tendon from really, really flat foot. If the foot's too flat, it can put extra strain on this posterior tibial tendon. You can see how the heel goes out. So those are all kind of interrelated, and it's not going to be a nerve problem. So just be aware, Achilles tendonitis, there are a lot of nerves around here. The posterior tibial nerve is nearby, and that could cause some nerve pain. as well. So let's go over the treatment process quickly. Reducing inflammation is the first thing, reducing tightness is the second thing, and then stabilizing the heel. Now, I want to tell you that treatment for Achilles tendonitis, if you come in quickly, it usually can be treated pretty quickly, but if you've had it for a long time, it takes a while, and there's a lot of different treatments, okay? So let's go over reducing the inflammation. Starting out, before someone comes to the office, they tend to try icing. You can take a styrofoam cup and put ice in there and then massage it on the back of the calf. You can also do like a bottle of water and rub it back there. That's going to help it as well. That's going to be a natural way to reduce inflammation. A lot of people try Motrin, ibuprofen, Advil to reduce inflammation. Resting it with like a walking boot can reduce some of the pull on the area. That's going to help it. When you rest it, usually we do a little bit of a heel lift. So imagining a lift underneath the foot. If you put a lift underneath there, it's going to reduce a little of the pull on the Achilles. So a heel lift is helpful as well. Cortisone injection. Usually we don't use cortisone into the Achilles tendon. You do it on the plantar fascia, but usually not here. And there's one kind of reason why you would. So if you think it's not the Achilles tendon, but it's a painful bursa, sometimes you can do a bursal injection either into the back or behind the Achilles tendon. That sometimes can be helpful. I usually recommend when you're doing a cortisone injection into that area, you put someone into a walking boot that we talked about right here, just to protect it, because it's been known that if you do injections directly into the Achilles region, it can cause tendon rupture. That's why we do not do it. Also be aware if you're on any fluoroquinolones like Cipro or Levaquin, there can be tendon injury with that, and the Achilles tendon was one that's commonly affected. Another way to reduce inflammation is a newer treatment called platelet-rich plasma. This is kind of a high-tech type of treatment. You draw your blood down, you spin it down, and you take just the top portion, which is the platelets, okay? There's platelet poor and platelet rich. You take the platelet rich portion and you inject it into the Achilles tendon. That increases the healing components, which is the platelets, and that helps heal things. Another similar type of a treatment is called shockwave, once again by causing, there's two little pieces of metal here that hit together, causing inflammation on this is for plantar fascia, but it can also be used on the Achilles tendon in the back. That increases good blood flow to the area, very similar to the platelet type of treatment, and this is usually done 3 treatments about a week apart. That's very effective to change a chronic injury into more of an acute injury to reduce inflammation. The second portion is to reduce tightness. People tend to overlook this many times. So reducing tightness, you can try a heel lift underneath the heel that lifts it up. That'll reduce tightness. You can also do deep tissue massage, which is recommended. I like the trigger point tools or foam rollers. These really, really help the back of the calf to loosen things up. Once again, looking at the anatomy, it's a lot easier to loosen up this red beefy tissue than it is this white non-stretchable material. So a lot of the deep tissue massage is up in the back of the calf. I'm going to throw it out there. Physical therapy is a lot of times recommended and needed. So there's a Graston technique that can be used for that, where you take a hard piece of metal and rub it down the back of the calf to loosen up any of the adhesions and tightness. Night splints, dyna splints can be used. I like to keep people more active, but for people that can't do the treatment themselves or can't do anything else, these are options. And as well, stretching is an option. If nothing else is available, doing kind of a stretch down on the stairs can be helpful. Don't overdo it, because a lot of times you can stretch and tear things. This type, you can also tear it by doing too much. That's why I like the deep tissue massage much better than the stretching. Normally, we don't recommend stretching in the office. Also, correcting heel alignment so you don't re-aggravate things. A nice supportive shoe is better than like a flip-flop. As well, correcting the heel alignment. If your heel is off, right? If there's eversion, this is called eversion, where your heel goes out, puts a lot more strain on the Achilles tendon. If you can correct things, it can help everything to function better, and orthotics are normally helpful for that. And as well, some other types of supports that you may try. Some patients try these before they come and see this, so just for completion, I put this in here. This is a Achilles tendon support called an air heel. It has a little air bladder here and an air bladder here, so as you walk, it goes back and forth, the air. A compression sleeve sometimes can be helpful. These really just put compression around the Achilles tendon and massage the area, very similar to this one where it massages it as you walk. And so hope that was helpful. If this doesn't get better, you should probably see a professional. You can take care of it a lot quicker. If you want some of my resources, here they are on centralmasspodiatry.com/Achilles. On there, you're going to find some articles on shockwave, on PRP, on EPAT, some information about heel lifts, and some actual videos that'll show you how to do the deep tissue massage, and an actual video showing about the shockwave therapy. Okay, hope you found it helpful. Thank you.